without further ado, I'd like to invite the director of AdipoLABs, Mr. Isaac, to share a little bit more in depth about the hyperthermia machine. Isaac.
Hi, thank you. Yeah, if you're hungry, I'll try to finish within 15 minutes. Just bear with me for a while. Okay, so I'm just going to explain to you about more about the device and how the treatment protocol goes about. Okay, I think Dr. Zawawi has mentioned about the benefits and all that. I will also touch a little bit on that. Okay, so this is how the device looks like. Okay, we call it the remission 1 hyperthermia. Right, it's mainly used for cancer treatment. Okay, all right. So before we go into, you need to know, is the device licensed in Malaysia? So as you can see here, we have a GDP-MD, which means that good distribution practice for medical devices. So in order to have a license for the company, you need to have a GDP-MD. So after you have this company license, then only you can apply for the device license. So this whole process will take about 2 to 3 years. Okay, so we have got all the license. So this is because when you sell to government or medical centers and all that, this is very, very crucial. Without this, you can be sued for using medical devices. Okay, right. And then we also have ISO certification for medical, and it's also Sharia compliant. In case if you are using for Middle East countries, this is one of their requirements. And we have this patent and authentications as well. And we have CE certs and Class 3 KFDA, Korean Food and Drug Administration. So we are fully certified. Okay, let me go into the remission 1 hyperthermia. All right, so remission 1 hyperthermia is also known as thermal immuno or adjuvant therapy. Why we call it adjuvant therapy? It is combination with chemo or radiation, or it can also with some other medications as well, like target therapy or immunotherapy as well. Right. So what is hyperthermia? Okay, as you know, hyperthermia thermal therapy. Okay, it is a treatment involves in raising the temperature of the body. Okay, for example, you need to raise the body temperature to 42 degrees in order to kill the cancer cells. Okay, so from 38 to 45 degrees, you also raise your body temperature is to also activate your immune cells. Okay, so we have two types of treatment: local and regional treatment. Local means, let's say the patient is having like head and neck cancer, so we do the applicator directly on the targeted area. Okay, regional is you do it on the systemic. Okay, systemic is to raise your whole body temperature up. Okay, and according to all these cancer societies, you see, they say that the benefits of hyperthermia is fully realized when the tumor temperature reaches 38 to 45 degrees. Why? Because 1 degree above your body temperature, okay, then you will have all these benefits of increasing your immune cells, and also for the cancer, right? And what are the clinical benefits you receive? Okay, firstly, what you see is it activates your immune system, all right, like NK cells, T cells, and lymphocytes. And then it also necrosizes your abnormal cells. Okay, your abnormal cells are like your cancer cells and all that. It relieves pain due to inflammation in the cancer patients. Okay, and it also does a blood vessel perfusion. That means it dilates your blood vessels. All right. Apart from this, these are the main four major factors. Apart from this, it treats bacteria and viruses. It treats hypoxia, Raynaud syndrome, hypertension, stroke, diabetic, kidney disease, heart failure, muscle, sports injury, and is also a blood vessel dilation. Okay, so all these details here you see here are backed up with science and clinical evidence. So we have data to show. So what you can do is you can just Google and check hyperthermia's benefit on, for example, hypoxia. Okay, when you just Google, you can come up with a full list of things recorded in the journals, medical journals. All right. So these are all clinically proven. Okay, And let me talk about a little bit on immune cells. Okay, so as you know, we have two types of immune cells: innate and adaptive. Okay, so innate is normally, you know, like when you have a cut, and then you know you have this pus coming out. You know, the white blood cells. Okay, those are normally done by the innate. All right, something like viruses, you got virus infection, then only you will have the adaptive, because when this sets of what you call immune cells which can't handle, they call for the bigger guys, the big fellas. All right, so when you look at adaptive, there is few types of adaptive cells. Okay, there is b cells, they will keep your antibodies. Okay, T cells. Okay, T cells are very special. T cells needs to be educated, all right, by the immune cells. One of it is called dendritic cells. Okay, then we have these natural killer cells. Natural killer cells, as you see here, it falls between both sides. It can be adaptive, it can be innate. Okay, but this cell is very, very special. You see, this cell, you don't have to be educated. The moment it's activated, no matter what kind of virus or bacteria, it can go into action, right? Okay, let's see some details about the NK cells. They call it NK cells. All right, according to this professor from he's the one of the chairman for KSTM, Korean Thermal Society. Okay, and he has done a research on NK cells, okay, natural killer cells. Okay, if you can see here, this is a cancer cell, and these are the NK cells, cancer cell and NK cells. When the cells are inactive, it doesn't go near the cancer cells because it cannot recognize. Cancer cells always, when they mutate, they have a false identity. Your immune cells cannot recognize if they are not activated. The moment you activate your NK cells, you can see all the NK cells cluster on the cancer cells. Okay, when they cluster, they go into attack mode and start to kill the cancer cells. All right, so you understand this part. Okay, now we ask how to activate the NK cells. And I'll give you some example here. Okay, this is purely a cancer patient's report, blood report. This they call this what they call NK cell activity test, which is also known as immunophenotyping scientifically. Yeah? So when you do a blood test to check your NK cell level, you need to know where is your line. Okay, for a normal person, it should be somewhere at 500. Okay, your reading should be 500. Cancer patients will be between -40 to 100. Borderline is 100 and 250. Normally, a cancer patient who has gone through a chemo cycle, it will be in this line. Okay, for example, like this patient, the activity level is at 4.5. All right, the moment you do hyperthermia, like for this, the same patient, they did 4 weeks of hyperthermia, and when they tested after 3 weeks, the NK cell activity went up to 2000. 2000 is a threshold. You cannot measure more than that, but it can go beyond that. Okay, you can see some graphs here. All right, those light blue are the ones before, and those orange bars are the one after. So if you can see all those after four weeks of hyperthermia treatment, all of them have improved in their NK cell activities. All right. Okay. Apart from NK cells, what you get, the second one, it necrotizes your cancer cells. Okay, it kills the cancer cells. How it happens is, you see, this is your normal tissues. Okay, when you apply heat on the normal tissues, your tissues can actually expand 5 to 10 times. It can expand and then it can contract back. But a tumor cells, what happens is it has a lot of blood vessels inside. When it has a lot of blood vessels, it cannot expand. So the expansion is only between 1.5 to 2 times. All right. So the moment it cannot expand, it breaks up and it dies. So the death of a cancer cell is called a cell necrosis. You can see here, necrosis. So the cell breaks up and it kills itself. All right. So what happens when the cell dies? Okay. For example, this is a very good chart. Okay. When you see a heat, okay, this is the heat, right? When you apply heat into your body, what happens is, first thing, direct heat to the cancer cells. When you reach 42 degrees Celsius, the cancer cells die. Okay, it calls a cancer cell necrosis. What happens when a cancer cell dies? Each cell will actually release something called an antigen. I think you're quite familiar with the antigens and all that, right? Due to COVID. Okay. So when it releases the antigen, there is a cell called dendritic cell. Okay, this dendritic cell, what is the job is, it's to pick up all the antigen from the dead cells, and then it goes to the nearest lymph nodes, and it educates the T cells. You see inside your lymph nodes, there's T cells. Okay, these are the T cells. All right. In our body, we have like 30,000 types of T cells. All right. Not all of them can recognize that particular strain of cancer. So what happens is when this dendritic cells goes in and educates the T cells, so these T cells, that particular type of T cells which can recognize the antigen, it will capture, and then it starts to come out through your blood vessels and go through the body wherever there is a cancer cell, the same kind of strain, it attacks and kills. Okay, why? Because you see, there is a locking mechanism. It's like a matching, bonding they call it. If the T cells cannot bond into that particular cells like this, they cannot bond, right? So it cannot match, so it cannot kill the cancer cell. But when the same antigen is picked up by that particular T cells, it has a locking mechanism, like a male and female. Once it bonds, then it can start to kill that particular cancer strain. All right. So apart from this, what happens is another very good benefit if you kill the cancer cell using heat. Okay, it inhibits the DNA repair. Okay, the surprising part, a damaged cancer cell can actually repair itself. They go into your bone marrow, repair itself, and come back with a vengeance. Like the Avengers, they come back with a vengeance. When it comes back, the same chemo which you used last time will not work. All right, you need to give a heavy dose, a different type of chemo. All right, so that's why when they have a relapse, it comes back much stronger. So if you kill a cancer cell using heat, all right, when you damage a cancer cell, it will block the repair. So the damaged cancer cells cannot repair itself. All right, so remember, with heat it cannot repair itself. All right, so this is the chart which shows the benefits of killing the cancer cells. All right. Okay, in US, there's a Hyperthermia Cancer Institute. They did a lot of studies on cancer using hyperthermia with chemo and radiation. All right. For example, you can see here, hyperthermia increases the blood flow to the tumor, which allows the better access of the therapy to the tumor. Okay, for example, have you heard of something called hypoxia? Right? For example, if the tumor is here and you're sending the what they call the chemo, and if your blood vessels are constricted, which is actually known as hypoxia, all right, the chemo doesn't reach the tumor, all right? But when you do a hyperthermia, it starts to open up all your blood vessels. So your chemo drug goes in better. So it reaches the tumor faster, okay? Because the passage of the chemo drug is, they call it the better delivery of drugs, okay, when you do a hyperthermia, all right? So when you do with radiotherapy, this is for chemo, when you do with radiotherapy, okay, for example, like if that area, the tissue is not well oxygenated, all right, and you do a radiotherapy, the radiotherapy doesn't work very well because it needs an oxygenated environment to get a full potential. That's why they use a lot of high dose of radiation to actually kill the cancer cells. But when you use together with hyperthermia, all you have to do a little bit of radiation, low dose, they call it low dose, together with hyperthermia, and you have a very good results. All right, because hyperthermia actually oxygenates the tissues. All right, so you get a better results. Okay, and yeah, as I said earlier, hyperthermia also have the effect of inhibiting the enzymes that repair the cancer cells. I mean, cancer DNA, right? So you all understand so far? Okay. All right, this is the graph. I think just now the doctor also showed. This is the graph to show just radio and chemo alone. This is the light blue, and with hyperthermia. So together with hyperthermia, you can see the results are almost double. All right. Okay, this is one fine example of one of the patients who had head and neck cancer. Okay, his cancer is around here. So what we did was we did 45 minutes of systemic hyperthermia at the abdomen and 15 minutes of hyperthermia on the target region with the smaller applicators. All right, this is after 8 sessions. You can see how much it has reduced. All right, so this is a typical case on directly killing the cancer cells. Okay, so you must understand, when you do hyperthermia, one of the first benefit is you raise your body temperature, whereby it activates your immune cells. Okay. Second thing, it's directly killing the tumor cells. All right. So what we did the temperature here. We brought this temperature here up to 45 degrees, and you can see the difference. Today, he's like a walking miracle. All right. So he's known as cancer free. Okay. And now it's about the hypoxic condition. For example, just now, I think doctor was also talking about hypoxic, right? When there is no oxygen in your tissues, okay? This is a typical example of, this is a normal patient, not a cancer patient. Before and after, before hyperthermia. Okay, this is the calf area, hand and abdomen area. Okay, you'll be very surprised. Okay, just by doing at the abdomen area for 30 minutes, okay, hyperthermia, you see a difference in your calf, down here, calf, you know. So before and after, you can see a 50% increase of oxygenation in your tissues. So this is how we test and prove that it works for hypoxic condition. You see, when your tissues are well oxygenated, cancer cannot thrive there, right? So but her condition is actually not so bad. If you look at the cancer patients, okay, this is the calf of the cancer patient. You can see it's totally blue. That means it's almost like zero oxygen, maybe 0 point something level. But after 60 minutes, you can see the oxygenation level in the tissues. All right. So we use something like this device. It's a scanner. It's a quite expensive scanner from Canada. We use that to test the patient before and after. So same goes to the abdomen area, chest, and hand area as well, right? Okay. Just now, I think someone was asking about a different type of hyperthermia and all that. Okay. So you see, this is the traditional method, Ayurvedic method. This is sauna, and they use a thermal blanket. Okay. And there's a clinical method. They use NIR or FIR, ultrasound, or capacitive thermal treatment. Okay, this treatment, I'm not saying it's not good. It is good, but mostly it's superficial. You see, what happens is our body generally will resist heat. When there's too much of heat, your body will resist. That's where it causes some blisters and things like that. Okay, and when you do like FIR and NIR, the maximum depth it can go in is only 3 cm. So it's skin and muscle level. So let's say you have a muscle problem, you got muscle pain and all that, so you can use NIR, FIR, it works well. But if you want to treat cancer, it is a bit difficult because it doesn't penetrate through the body. Okay, that's where this device comes in. Okay, it's the world's first 0.46 megahertz, because normally 0.46 megahertz outside your body, the heat you cannot go in. All right, why is it 0.46? It is on your skin. The device is on your skin. It's the difference. Right? For example, just now as doctor was also mentioning, you see the radio frequency actually passes through your body with the top plate and the bottom plate. It passes through with the plus and minus ions. So what happens, in your body you have water molecules, right? So the moment you have a radio frequency flow, your water molecule starts to vibrate. You can't feel the vibration, but it vibrates, very tiny vibration. Very simple theory is, you see, when you rub your hand, can you rub your hand? You feel warm, right? Can you go faster? You feel hotter, right? Okay, imagine you're rubbing at 460,000 times per second. That's very, very fast. Smoke will come out, it will probably catch fire, right? So that's how it happens inside. Your water molecules rub and collide into each other, causing a internal heat. So the difference is the heat is not from outside in, it is inside out. So what happens is the heat actually starts from your core. See, core area. Okay. For example, if you have time, you can test. You can put your palm on the. There's two plates. For the bottom plate, and you put another plate here. You will not feel heat here or heat here. Your heat will be here at the center. Okay, that's the technology, because why? It sends a signal right through. The mid section starts to heat up first. Then only it expands to your whole hand. Right? That's the difference. So it is not an external heat going in, it's your internal heat. This device will actually cause your body to raise your body temperature. All right, your body will then, the effect, the water molecules, and then you radiate throughout the whole body. Sometimes you will feel very hot here. Why? Because the heat from your body is actually reflecting on the plate. The heat from here reflecting here, causing this plate to get hot. But this plate by itself is not a heater. It doesn't cause heat. Right? Your body's heat. Right. Okay, so we have done animal tests to prove that whether or not the heat is going into your organs. Okay, these are the stomach, liver, and abdomen under skin. After 50 minutes, you can see it is almost reaching 42 degrees. And when you switch off, it goes down very slowly. Even after 50 minutes, it is still 38 and above, between 38 to 41. Okay, that's why after you do the hyperthermia treatment for 6 hours, you're not allowed to drink cold water, no beer, and cold shower. All right. So because when you do that, you are actually fighting against the heat. You need to confine the heat in your body. All right. Okay, this is how the system looks like, the hyperthermia. It comes with a bed, and this is a systemic applicator. Okay, this is where you put it on your abdomen area. Okay, and then we have this target applicator for smaller size body, we can use it. And this is target one for, like, let's say head and neck cancer, like just now you saw the uncle. We use this kind of applicator on the neck, right? So this is a typical hospital setup, how it looks like. Later you can see it in the room. Okay, we have done some clinical studies with UMMC, very fantastic results. Okay, these are the patients. Okay, we also done some kind of clinical trial for COVID-19 in Korea. This is doing the Delta variant, the highest peak of Delta variant, year 2021. All right. So the results was after 2 days, just 2 days of treatment, the CT level will go up more than 30. CT means cycle threshold. Okay, they put in a centrifugal and then they spin, right? After 30 spins only, it can be detected. That means it's no longer infectious, right? Okay, so where we have this treatment, we have in Penang, a few parts in Selangor, and also in Johor. We also have in Sabah at the moment. All right. Okay. Summary. Okay. Hyperthermia alone can shrink cancer tumors with a temperature between 42 to 45 degrees. It can activate immune cells with a temperature of 38 to 45 degrees, can improve blood circulation and oxygenate your tissues. It can relieve pain for cancer patients who have tumors inside, which cause pain. It can relieve the pain. It can improve the overall survival rate in a cancer patient. Okay, when you combine hyperthermia with chemotherapy, it brings more chemotherapy inside the tumor and heightens the effectiveness of chemotherapy drug. Okay, and also hyperthermia has the effect of slowing down enzyme to repair the DNA which damaged by chemo or radiation. Right? For radiation, when hyperthermia is provided along with radiation therapy, is the better response of the radiation. The tumor shrinks more than is provided with radiation alone. Okay, the tumor shrinks more than just using radiation alone. So the combination works very perfectly. All right. Okay. Just a last note. I don't know, some of you may know this, father of modern medicine. Okay. So he has a very famous quote. He says that those disease which medicine cannot cure, medicine like chemo or pills or whatever cannot cure, knife cures. Knife is referring to surgery, cures. Those which knife cannot cure, fire cures. Fire is referring to hyperthermia, heat, okay? Those which fire cannot cure means satu poci, gone already, finished, cannot cure already. Okay, so this is not me, it is said by Hippocrates. All right, okay, I'm already end of the slide. Okay, thank you. All right, we have some lunch prepared for you. All right, although it's not so healthy for cancer patient, but it is okay for us to eat. All right, and we are giving like from 1st July until today, we have free consultation service. It's sponsored by AdipoLABs and TSL Nutraceuticals, right? By a doctor from India. He's a very popular MD doctor plus Ayurvedic doctor put together. He gives you free consultation. That means if you know anyone who has cancer or any other diseases, he can give you a free consultation. The doctor is here, so maybe later when you're having lunch, you can talk or discuss with him. All right, Dr. Danny Devasi. Yeah. All right. Probably later he can just come up and introduce himself. Okay. And okay, he's also having a talk on the 5th July at between 2 to 5 p.m. All right. It will be more on what you call cancer related subject, and also there'll be a nutritional talk to talk about how to use proper nutrition. Certain things you'll be very surprised. When I heard the nutritionist talk, she said, we think that when you blend the vegetables together and then you drink it, you think it's very healthy, right? All vegetables, right? This actually is wrong. It actually kills your kidney. So, right? So certain things you are doing, it may not be right. So it's good to listen. We'll be also having a live session. All right, for you to listen, you can ask some questions, then she can answer. All right. Okay. Thank you. Lunch is served. Thank you. Right.
I'd like to give a memento to Mr. Isaac.
Oh, wow. Yes. Okay. Okay. Thank you.
Thank you.
Okay.
Thank you.
Okay. Come.
Wow. Going on national TV. Right? Thank you.
Okay. Thank you. Thank you so much.